Depression by Grace Wayman. Depression is a condition of general emotion dejection and withdrawal. Sadness greater and more prolonged than that warranted by any objective reason. These are the chemicals commonly associated with depression. Neurotransmitters are chemicals that send signals around the brain. Acetylcholine is a type of neurotransmitter that affects one's mood. It also affects one's sensory neurons and nervous system. When acetylcholine is increased, positive mood decreases. Therefore, depression is a result of high acetylcholine. Norepinephrine is a neurotransmitter that affects our nervous system and social interaction. This chemical is also involved in the regulation of emotions. When there is not enough of it, one experiences depressive symptoms. Dopamine can be involved in addiction. People with depression who turn to self-harm usually become addicted. In addition, dopamine is involved in motivated behaviors. People with depression do not have enough dopamine, so they often lose their sense of motivation. GABA is associated with anxiety. Too little of this chemical causes anxiety, and depression and anxiety are commonly found affecting one another. Glutamate is a major neurotransmitter and has recently been found to be linked to depression. It is an excitatory neurotransmitter, which means that it is what causes excitement. When one's nervous system is unable to effectively use glutamate, it causes depression. When serotonin cannot be made or received by a receptor, there is an imbalance in the brain. This causes change in one's mood and emotion, causing depression. The most common antidepressant is a medication which supplies more serotonin to the brain. When one has a lot of endorphins, anxiety and depression are reduced. However, people with depression do not have enough endorphins. This chemical can be obtained through exercise. Though scientists have not confirmed that depression is hereditary, they have a strong belief that it is. It is clear that depression runs in families, and the gene for depression is passed down from generation to generation. However, this does not mean that the gene for depression will be activated in one's lifetime. Depression is said to be triggered by a traumatic event in one's life. Depression shortens the protective caps on chromosomes, which often causes immune system cells to age prematurely. This also causes cells to die or become unable to replicate properly. This creates mutations in one's cells. Depression causes overwhelming sadness, feelings of worthlessness, an inability to focus, changes in sleep or eating habits, a lack of commitment, and a loss in one's interests. Depression can be hereditary, but you can also acquire it through going on medications or a reaction to a medication, puberty, experiencing traumatic events, and hormonal imbalances. Hormonal imbalances are not always pubescent. They can be caused by onset menopause, pregnancy, and changes in age. People with depression are not always depressed. Rather, they often experience extremes. Extreme happiness, extreme sadness, extreme loneliness, and extreme motivation. Though people with depression lack serotonin and dopamine, the chemicals still contribute to the brain activity. Therefore, people with depression are able to live normally throughout periods of their lives. However, people with severe depression cannot cope as easily as others, which is why these individuals are able to receive medications to balance out their serotonin and dopamine levels. Depression can be treated through medication. Additional treatments can include therapy, rehab, and coping methods. There are many types of therapy which allow a patient to cope with their depression. Two examples of therapy include cognitive behavioral therapy and electroconvulsive therapy, a surgical procedure. Cognitive behavioral therapy focuses on the relationship between thoughts, feelings, and actions. Cognitive behavioral therapy, or CBT, allows a patient to identify their negative thoughts and improve on them. Individuals with depression will call themselves worthless, and CBT forces one to change their ways of thinking in order to avoid self-destructive actions. Electroconvulsive therapy sends a series of shocks into one's brain, inducing a seizure. This surgery reduces the amount of energy used in the brain, which allows the brain to slow down the process of thinking and mood changes. Rehabilitation centers are for people who have grown addicted to self-harm or are at risk of hurting themselves or others around them. Coping methods include meditation, but can also be classified as self-harm. People find it easiest to deal with their problems or express their worthlessness by cutting, scratching, or purposely hurting themselves. Cutting also releases endorphins, which are what allow one to be happy, so it is what seems to be the only way for people to handle their problems. Thanks for watching.